We do have a lot of emergency cases that our patients call. Usually are mostly related to trauma cases, especially, at least in our field, is usually the front teeth trauma cases where a tooth is broken and they get to see us. And our goal is to make sure they leave that day where the situation has been addressed. So if the tooth is fractured, that is unfortunately non-restorable. Our goal is to, they're a good candidate where we can actually remove the tooth, place an immediate implant that same day, and also make sure they leave with a fixed provisional for that tooth. That way they walk out better than they walked in. So highly aesthetic and also the least amount of pain and discomfort, because usually with most of the time those procedures, there's not a lot of flap elevation or any kind of suture involvement into it. However, there are other emergency cases where patients walk in where there are really pre-existing infections and they're experiencing severe pain and discomfort. Those ones do, of course, require us to do more advanced surgical procedures to them. That might include more extraction, drainage of any areas that present with more of a surgical abscess that we have to address. So emergency cases we do actually address very routinely. Every case is different, one from the other. And our goal is to, of course, understand what the diagnosis is and what is the best recommended treatment to approach and hopefully help our patients and make sure they leave with the most comfort amount possible.